it comes to Black mental health, there's just not a lot of resources or services available. Typically, there's policies and procedures in place that make it hard for Black young folks and their caregivers to access mental health services. Hi, my name is Julian Waith, and I'm the trauma specialist at Wanasah Mental Health Services for Black youth. We wanted to create a grassroots organization to address mental health, to address racial trauma, intergenerational trauma from a Black-centric lens. Our overall goal is to ensure that people are actually finding frameworks of understanding. And we think that, therapy is the talking cure, we call it. It's curative, and dialogue is curative. And Wanasah means, the definition of Wanasah actually means dialogue. So we're having conversations together. We're targeting young adults aged 16 to 29, as well as their caregivers and people that they love and value. So a big problem in the community is mental health and addictions, and overcoming that is really difficult when you're dealing with COVID, which disconnects people from their communities. It made things so difficult, but also gave us opportunities to say, how do we do things differently? How do we use creativity? How do we engage in a different way? So we're offering community healing events pretty much every month, which brings everyone together and doing different therapeutic activities that they might have never been exposed to. We're trying to really create something that everyone feels like they belong. And I think that's when it comes to trauma, we know that people's fight and flight systems are kind of devastated. They're shattered. That makes it so hard for them to reconnect. So these initiatives are hopefully helping people get to a place of healing, a first step. The specific community we serve has specific needs. So we're starting off doing a needs assessment, which includes our youth ambassadors, which provide us corrective feedback with the program and tell us when we're getting off the rails and going off track. Because it's young people who have gone through our program, who have a reputation in the community that people admire and look up to, and they're part of the process of bringing people together. Another problem is engagement and having people access mental health services, especially for Black young folks. So with the youth ambassadors, they're helping us project a different narrative of what mental health could be. So a different future for Black mental health. And we're reframing the narrative of Black mental health, and we can't do that without youth ambassadors who are involved in interviewing staff. They're involved in the community healing events, helping me plan and helping the team plan. Involved in focus groups as well, to make sure that we're creating this curriculum that is from the community. Because if we just copy and paste a curriculum for a therapeutic modality from another agency or another approach that's not rooted in this community, we know it's likely to fail. So the curriculum development is for the young folks, hopefully for the caregivers, but also for the service providers. And when I say service providers, I mean the people on the front lines doing the work every day. When it comes to therapy, we typically get an hour or 2 hours a week with a young person. The youth workers and the community providers are there every day, spending out countless number of hours, and we're acknowledging that they need supports, and they already have so much skill and talent, so why not work together and collaborate with the service providers? There's a spirit of hope that's kind of permeating in the community, and it's like I can see the change already, and I can see the work is making an impact. So it makes me emotional, it makes me so happy and joyful that the work, if given the opportunity, if given the resources, we can really make this impact, we can make the community change. People in the past have told me, this is something we can't do, or you have to do it in a different way, or you have to adapt, but it's like we're seeing that Black youth will come into a mental health space and actually transform their lives.